So, Bachcha Party, we are going to here talking about the basics of the renal pathology, and I'm going to make you revise some of your anatomy and physiology. Now, if you look it into here, I've already marked it that this is your right kidney, and the shape of the right adrenal gland is pyramidal. So, how you remember that? That the right kidney is slightly lower. Why slightly lower? Because it has a pahad of musibate on its head. So the right adrenal gland is pyramidal in shape, and because of this heavy pyramidal shape adrenal gland, the right kidney has moved down. Whereas if you see the left adrenal gland is concentric or the moon shaped. कितना छोटू सा पड़ा हुआ है. So the left kidney is slightly upwards in the left kidney. Second most important thing for you to remember is this is your hilum. This is the hilum of the kidney. And what is the anatomy of the vessels going into the kidney is VAU. VAU. What is the most anterior? That is your vein. Next comes your artery and ureter. Ureter is the most posterior structure of the kidney. Ureter is the most posterior structure of the kidney, and this ureter is entering into the kidney. This structure here, it is forming the renal pelvis. Then you have the major calyx, and then you have the minor calyx. Now apart from that, let's hear into that the kidney is a capsulated organ. We all know that renal kidney is a capsulated organ. What else? What other capsulated organs we have? You have thyroid, you have ovary. Thyroid, ovary, kidney are all capsulated organs. So whenever you get a gross specimen, you have to mention about the capsule. And in RCC, the capsular invasion upstages the tumor to T3. So in T1 and T2, the tumor is confined to the capsule. When it moves out of the capsule, the tumor is upstaged to T3. So in all of these encapsulated organs, they are very important as far as the staging of the tumor is concerned. Now point number 2. Here you see the cortex. Cortex is lightly stained, as we all can see in here. After that cortex, you have this medulla. How is this medulla arranged? Medulla is arranged into pyramids. Medulla is arranged into pyramids, and the cortex which is going in between the medulla is known as the medullary cords. This is the medullary cords, the part of the cortex going in between the pyramids. Now what is this white structure in here? When, as you can see, the pyramids are triangular shape, and the tip of the pyramids have a very low oxygen tension. So they are already in a condition of hypoxia, and whenever there is cell injury, whenever there is ischemia, this leads to the tip of the pyramid or the papillae to get necrosis, and there when you get papillary necrosis. So there are three important causes of the papillary necrosis. One is sickle cell disease, one is analgesic overuse, and another is your diabetes mellitus. So SAD, remember this as a mnemonic. SAD causes papillary necrosis, as in necrosis of the tip of the renal pyramids or the renal medullae. Okay. Now if I move on to the finer structure of it, important that we have already discussed, important for you is this is a ureter. Here the ureter is entering, and this part is known as the renal pelvis. Then you have the major calyx, and this is the minor calyx. So most of your nephrons are located superficially into the cortex. Okay? Then they are mid-cortical nephrons. These are the juxtamedullary nephrons. What are juxtamedullary nephrons? These are the nephrons which are present just at the junction of your cortex and the medulla. Here, whatever nephrons here are present or are known as the juxtamedullary nephrons, and these nephrons are very important as part of important as far as your filtration is concerned. So all of us are aware that the functional unit of the kidney is a nephron, and within the nephron, the juxtamedullary nephrons are the most important. Now if you see what is a nephron composed of, this is your nephron, as you can see. Okay, it has a proximal tubule, it has a distal tubule, it has a collecting tubule or the collecting duct, and then we have the loop of the Henle. All of us are aware of these structures from our anatomy and physiology, but let me highlight more that the dilated part of the PCT is the Bowman's capsule. So the Bowman's capsule or your glomerulus is nothing but your dilated PCT. It is your dilated PCT. Okay, so what is happening? You have the vessels coming in here, the renal artery, the renal vein, and they are breaking into these capillaries, and the dilated part of the proximal tubules receives those capillaries. So if you see the cross section of the glomerulus here, look at it. If you see the cross section in here, what do you see? Please imagine this was your efferent arteriole. We have cut it like this. Okay, this was your efferent arteriole coming in. This is your efferent. This is your ascending limb of loop of Henle, and surrounding this there would be PCT ducts only. So this is basically proximal convoluted tubule only, which is dilated into a cup shaped structure to receive the glomerular capillaries. So these are your glomerular capillaries that you are receiving. Now lumen of the capillaries will have endothelial cells, और इनके बीच बीच में कुछ होते हैं तुम्हारे mesangial cells. Mesangial cells are the supporting cells that are going to support your glomerular capillary. तो अब अगर मैं देखूं, एक चीज जो तुम्हारे लिए इंपॉर्टेंट है टू रिमेंबर इज फर्स्ट इट्स योर जक्स्टा ग्लोमेरुलर अपैरेटस. जक्स्टा ग्लोमेरुलर अपैरेटस क्या है इसमें? इफ समबडी आस्क्स यू व्हाट इज इन हियर, प्लीज लुक एट. This includes your macula densa. Macula densa are the part of the cells which are in close contact with the afferent and the efferent arteriole. And what are they? They are the cells of the ascending limb of loop of Henle only. So you have this macula densa cell which are in contact with the टर्मिनल पोर्शन ऑफ द आफ्रेंट आर्टीरियोल. आफ्रेंट आर्टीरियोल का एकदम लास्ट वाला पोर्शन जो ग्लोमेरुलर कैपिलरीज में ब्रेक होने वाला है. देन द बिगिनिंग पोर्शन ऑफ द इफरेंट आर्टीरियोल, जहां से इफरेंट आर्टीरियोल स्टार्ट हो रही है, and the supporting extra glomerular mesangial cells. mesangial cells जो कि glomerulus के बाहर है. So these are forming the juxtaglomerular apparatus, और यहीं पे रेनिन और रास एंजियोटेंसिन सिस्टम का रोल होता है जो कि हमारे ब्लड प्रेशर को कंट्रोल कर रहा है. Now part which is important in pathology, if you look at it, what is happening? It is being thrown into the glomerular capillaries. Now this is your parietal epithelium which is being formed by the cells of the PCT. ये glomerular space का parietal epithelium है. Now if you look at this, this is not forming any filtration barrier or the filtration unit. ठीक है, ये तो उस यूनिट के बाहर है, तो आपकी जो भी filtration unit होगी, it is being formed in here. Now let's look at what is this filtration unit. देखो ऐसे ही था हमारा. वी हैव कट सेक्शन थ्रू इट. दीज आर दी afferent and the efferent. These are the capillary loops. Here we have cut through the glomerulus or the Bowman space. This was the urinary space. We have cut through it, and now look at it, what you are seeing. Can anybody identify? This was the parietal epithelium जो हमने बोला था PCT से बना हुआ है, proximal convoluted tubule से बना हुआ है. तो इसका तो कोई filtration में काम ही नहीं है, बात ही खत्म हो गई. This is a urinary space. ठीक है, this we had spoken about. If I go earlier backwards, this is your urinary space. ठीक है, जहाँ पे यूरिन आके कलेक्ट हो रहा है, ये कैपिलरीज हैं. अब हमने अपने फिल्ट्रेशन बैरियर के थ्रू अगर इसको चेक करें, इफ यू लुक एट दिस, दीज आर योर ग्लोमेरुलर कैपिलरीज. दीज आर योर ग्लोमेरुलर कैपिलरीज. अब ग्लोमेरुलर कैपिलरीज की ये जो है, ये जो लाइनिंग है, दिस इज योर बेसमेंट मेम्ब्रेन. So whenever we talk about GBM or the glomerular basement membrane, we are talking about the basement membrane of the glomerular capillaries. Is that clear? Now basement membrane के अंदर क्या होगा? ये वाले cells, these are the endothelial cells. These are the endothelial cells. और endothelial cells ऐसे एक के बाद एक नहीं लगे होते हैं. They have the gaps in between. So the endothelial gaps are present, and the gaps are approximately 70 to 100 nanometer का distance होता है. This can be a question sometimes to you कि endothelial cells के बीच में कितना gap है. That is approximately 70 to 100 nanometer. So we have a basement membrane जिसके अंदर we have endothelial cells, and outside this are the epithelial cells. If you can see these are your epithelial cells. और epithelial cells को हम और क्या बोलते हैं? We call them as podocytes, or the podocytes are nothing but the foot processes of the epithelial cells, because the epithelial cells are not flat. The endothelial cells are flat. We have basement membrane. The podocytes are arranged like a foot process, and they are also not very close contact. They also have space in between, and this space is called as the slit diaphragm or the filtration space, slit diaphragm, sorry, slit diaphragm, ठीक है. एंड द स्लिट डायफ्राम का डिस्टेंस होता है, इट इज अप्रोक्सीमेटली 30 to 50 नैनोमीटर. ओके, सो इफ समबडी आस्क यू द एंडोथेलियल सेल्स have endothelial gaps which measure 70 to 100 nanometer, while the foot processes or the of the epithelial cells have a space approximately 30 to 50 nanometer in between. So now if I ask you, if somebody asks you what forms the filtration barrier, so you have the endothelial cells, the glomerular basement membrane, or the visceral epithelial cells, or the podocytes. It is the visceral epithelial cell. Remember, the parietal epithelial is much outside the urinary space. It is a part of the PCT. It is not involved in the filtration process. Now, what supports these capillary loops? These are the mesangial matrix, or a mesangial matrix is been secreted by what? By mesangial cells. So these are the mesangial cells which secretes the mesangial matrix, which keeps the capillary loops in together in place. Now, abhi we were talking about this filtration slit or the slit diaphragm and the podocytes or the food processes Now, what proteins they are being made of? Because in focal segmental glomerulosclerosis, most importantly, these proteins are affected, or there are genetic mutations in these proteins which lead to nephrotic syndrome. So, what proteins are there? We have nephrin, we have पोडोसिन. इंपॉर्टेंट फॉर यू टू रिमेंबर. पोडोसाइटोपैथीज आर व्हाट? जबकि ये फूड प्रोसेसेस का इफेसमेंट हो जाते हैं. नाउ कैन यू सी दे आर ऑल फ्लैट, दे आर डिस्ट्रॉयड. सो द नॉर्मल फिल्ट्रेशन स्लिट, जिसको खाली सेलेक्टिव प्रोटीन यूरिया या ओनली प्रोटीन्स वगैरह को इट हैड टू रिस्ट्रिक्ट, नाउ दे आर बीइंग फ्रीली फिल्टर्ड अक्रॉस द ग्लोमेरुलर कैपिलरी मेम्ब्रेन. Another important concept for you to remember is the electron microscopy ka picture. So I am just talking in here about the basic electron microscopy picture. If you appreciate this black and white picture, this is your basement membrane. This is your basement membrane. Basement membrane के अंदर कौन से cells होंगे? These are your endothelial cells. और basement membrane के ऊपर वाली side में कौन से cells होंगे ऐसे निकलते हुए? These are your podocytes or the food processes of the epithelial cells. When you find them effaced, when they are being merged together and when they don't retain their food shape, this is called as the effacement of the food process. The most common cause is minimal change disease, where light microscopically you do not find anything, but if you look at the electron microscopy, you find the effacement of the food process. So all of these conditions where there is effacement of the food process, we call them as podocytopathies. What do we call them? Podocytopathy. So electron microscopy is a must and a very important diagnostic clue in all of the nephrotic syndromes or the renal pathology. इलेक्ट्रॉन माइक्रोस्कोपी की तो बात कर ली, पर लाइट माइक्रोस्कोपी आई फॉरगॉट टू मेंशन अबाउट. कैन एनीबडी आइडेंटिफाई? दिस इज द फर्स्ट स्टेप दैट वी डू इन हियर. Light microscopy, H&E staining is the first step that we do in to identify any renal pathology. So this entire space is what? These must be your parietal epithelial cells. This is your urinary space we had spoken about. ठीक है? And now these are your glomerular capillaries. Glomerular capillaries which are being having or glomerular basement membrane which they are lined by. इसके फाइनर अगर स्ट्रक्चर देखना होता है तो वी नीड टू डू सम स्पेशल स्टेन्स एंड वी नीड टू डू इलेक्ट्रॉन माइक्रोस्कोपी. H&E स्टेनिंग में हमें सिर्फ यही दिखेगा दैट वी हैव capillary loops in here. And what are these blue cells? These are the nuclei of the mesangial cells. Nuclei of the mesangial cells. अब कोई भी pathology होगी if the mesangial cells are increasing in number, that is called mesangial hypercellularity, that you find in where you find most commonly either in MPGN or you find it in post-streptococcal glomerulonephritis. Okay, now we want to find out thickness of the glomerular basement membrane also, whether it is being thickened or not, or what it is, or there is some increase in the mesangial cellularity. So kidney biopsy mein always there are some special stains that are being required to done. These are pass stain that you need to highlight the mesangial matrix और the basement membrane. Matrix बढ़ा हुआ है कि नहीं, mesangial hypercellularity तो नहीं है, sclerosis है तो नहीं है, or you need to highlight the glomerular basement membrane. Then also we do the pass staining. Silver stains, Jones or methenamine stain is also used to highlight the glomerular basement membrane. And very important in here, fibrosis. collagen or the mature fibrosis is being highlighted in here by the Mason trichome staining. So special stains are very very important in kidney, and this was just the basic overview of the renal pathology, because to understand any of the pathology in the kidney you need to understand this basic structure.